Thank you, Mr. Chairman. Dr. Means, welcome to the committee here. I'm going to stick with vaccines here because I am on. I'm red. Is it better? Better? Yeah. Just too far away. Sorry about that. Sticking with vaccines, you have stated that there is, quote, growing evidence that the total burden of the current extreme and growing vaccine schedule is causing health declines in vulnerable children. And so I've heard your comments to several of my colleagues here today, so I want to drill down more specifically to the hepatitis B vaccine. My state of Alaska has had a very long history with this, including early childhood immunization campaigns that were targeted specifically to Alaska Native communities. We were seeing some just really startling issues with regards to liver disease in Native children. And so it was a pilot project decades ago that allowed for critical, timely vaccinations for these Native children in the outlying areas. It made a remarkable difference in Alaska, and I think other states, other countries look to that as an example. You have expressed the skepticism about the Hep B vaccine for newborns, and I need to try to understand your thinking on that, given the medical consensus that this vaccine prevents this serious liver disease and liver cancer, that we, again, were able to demonstrate in real time, real life, with that recommendation. And now the view that you seem to be taking on this is it is not necessary for newborn.
Thank you, Senator Murkowski, for being willing to want to clarify this with me, and also thank you for meeting with me. I really enjoyed our conversation in October with you and your staff. I think the concerns and comments that you're sharing, I think they're incompletely representing my views, and so I'll take the opportunity to share. This is an effective vaccine. I think it's a very important vaccine, and I think it's obviously Senator Cassidy knows better than anyone, given his work. This is a vaccine that has saved thousands, millions of lives. I don't know the exact number, but I do think that this administration is committed to making sure we have the safest vaccine schedule, and that parents have the opportunity to have shared clinical decision-making on specific vaccines with their doctor so they can make the best decisions for their family. This is not a condemnation of the vaccine generally, which I am very supportive of. However, I do believe that the thrust towards parents wanting to have the ability to have shared clinical decision-making with their doctor is important when there are conditions like hepatitis B where there's differential risk amongst different populations.
So you have said that the Hep B vaccine is, you stated this in response to a question on a TV show, is for a sexually transmitted disease and an IV drug user disease, which of course babies are not going to be exposed to. And one of the things that we have certainly seen with Hep B, recognizing that it's this blood-borne pathogen, 100 times more infectious than HIV, not just contracted through sexual contact or drug use. In Western Alaska, where we see Hep B as endemic, we find that it's being spread through mosquito bites, where a child is itching an arm, ordinary household community contact, whether it's sharing food, toothbrushes, and minor injuries. And so this is where many in my state are looking at this and saying, we have been able to turn the corner on this. We're no longer seeing children with liver cancer, with this liver disease, and it is because the hepatitis B vaccine has been made available to them at birth. And so my hope is that as you are communicating the value of childhood vaccine, that demonstrated positive results of vaccines just like this would be communicated and not just everybody needs to consult with their doctor. But if you're an Alaska Native population that has been systematically impacted in a way that we've now seen a marked difference, it seems to me that's where you should be directing it. I'm well out of time, sir.
Thank you.
Thank you.